My name is Samantha Tilley. I am currently pursuing a master's degree in counseling psychology with Yorkville University. For this assignment, I'll be doing a video submission and we'll be looking into the course on the cognitive behavioral modalities. So I'll be discussing the importance of agenda setting and the critical role that it plays in cognitive behavioral therapy. So agenda setting is a really essential aspect when it comes to delivering CBT effectively. It helps structure therapy sessions and ensures that both the therapist and the client are both going to stay focused and on course with pertinent issues and the main ones that they want to focus on in that session. So in this presentation, I'm going to explore the 7 components of agenda setting, and I'll support that with relevant literature that will be found in my reference list in the Word format that is accompanying this video link. And I will also be going just through some practical illustrations. So I'm also going to highlight some common difficulties that counselors or therapists may face when they're setting agendas in cognitive behavioral therapy and give some strategies that would overcome these challenges depending on the scenario. So first, I'd like to delve into agenda setting and discuss how it can help with therapeutic outcomes and improve client engagement. So to kick it off, I'd like to go through the 7 components of agenda setting. So first, the therapist will start with a brief review of the last week. So the goal of this is to identify significant events and any continuous themes that are taking place once again that might have occurred in the past week and now are presenting themselves in this session as well that we're noticing are recurrent from the clients last week. So this will allow both the therapist and the client to set the tone for the next session and just really dig into the most pertinent issues that they're trying to tackle here. So the supporting literature to accompany this and some of the findings from that. So from the Kennerly et al. Textbook in the course, the authors emphasize the need to prioritize the main issues for discussion here. So an example of this would be stating, so what you seem to be saying is, and that really helps narrow down the focus with the client and just guarantee that the therapist and the client are on the same page when they're zoning in on these pertinent issues that are reoccurring. So in a reading by Simons and Griffiths, all of these are found in the reference page at the end of this assignment. So in a 2018 article by Simons and Griffiths, the authors highlight the importance of going over a brief overview to make sure that focus isn't lost during the session. So when we go through this review of the last week, it makes sure that we can stay on track and that we don't waste any time in this valuable hour and a half that we have by veering off into other areas. So they do suggest that spending too much time on greetings, casual conversation, and any non-therapeutic content can really detract from the effectiveness. So it's good as counselors and CBT practitioners that, as tempting as it might be to engage in other conversations, we really want to start with this number one goal and go into the review of the past week with a purpose and with a mindset that we want to know how the client is feeling here and know what their main points are. So in an article by Eubank and others, they found that an initial focus on therapeutic content correlates with better client outcomes. So this really shows the need to keep reviewing, keep the review concise and short, and focus only on the important events that are related to therapy, especially if the client starts to veer off into other issues of their life. Let's make sure to really recenter them and say, okay, so let's pick up on what you seem to be saying back to main topic, just to make sure we're not kind of dancing around their whole last week or things that might not be as important or necessary to get to our main goal of the session. So in another article by Wolk et al., that was published in 2019, the study does show that clinicians that clinicians do often prioritize reviewing homework for the week, so whatever they gave the client at the last session, and reflecting positive attitudes that can really help maintain a structured positive session. So by starting off with this main goal, or with this first goal of reviewing the past week, can really help stay on track. So this is shown in the video number one, uh, the first one that was watched, where the therapist checks in with the client, about their feelings and the homework from the past week. And then in the second video that was assigned, the therapist reviews the last session and asks for feedback on what the client's past week was. And sorry, I just wanted to add some clarification that the first video that I'm referring to, just to give some more context, is titled CBT Therapy with Dr. Todd Grande. And the second video is Introduction to Cognitive Behavioral Therapy, in brackets CBT, Techniques and Tools by Qualia Counseling Services. So just for the sake of clarification in the remainder of this video, I'll refer to the video as the video by Todd Grande when referring to the first one, and the video by Qualia Counseling Services when referring to the second. So going into the second part, the second step to agenda setting is to review the last session. So this kind of goes hand in hand in reviewing the past week, but this is really zoning in on what we're working on, what like exactly not just what's going on in the client's world, but what the therapist is working on with the client actively and the goals that we're already tackling. So the main purpose of this is to really address any follow-up issues, or any issues that might be unresolved from the last session, just to make sure we can maintain that continuity. So the supporting literature that I would like to look into, just to share more on this point of agenda setting. So Kennerly et al. In our course textbook discuss the importance of giving honest feedback, and reviewing the last session notes to keep the therapy on track. So let's find out from the client how they honestly are feeling about how that last session went. And maybe there's some things they really liked, and maybe there's some things that they didn't like. And remaining open to that as a therapist and asking them to share that and providing a comfortable space for them to do so is really going to allow us to delve into what's working for them, what isn't, and keep things right on track. So in the article, once again, I'll refer to by Simons and Griffiths, that was published in 2018, the authors really discuss the importance of looking over homework, ensuring that it was not only completed, but it was also understood. So maybe there's some things where the client needs a bit more clarification, and this is how we can review how we want to give them homework moving forward and make sure that we're not wasting any time or letting them waste any of their spare time by giving things that may be confusing. So just helping refine our practice as we continue to work with this client. In a 2020 article by Eubank et al., the authors emphasize the importance of consistently reviewing homework and past sessions, and how past sessions can really improve the patient outcomes as well. So just being in constant conversation of what's going on, and that's okay if they want to share that maybe there's something they don't really like. We need to be open as their counselor to adjust, because at the end of the day, flexibility is important when we are catering to our clients' needs. So in a 2019, in a study by Wolk et al., they found that that clinicians who have a strong intention to review homework, that's an often indicator that they do view this as a critical part of therapy. So this is a very important aspect to go through when doing CBT practicing. So in the first video by Todd Grande, the therapist exhibits this review of last session by continuing conversation from the previous session about work difficulties that the client was facing. They did also discuss some things regarding her relationship and her school, but really zoned in on what they were working on from last session, just to check in on how that was going and how they would like to carry that through. So in the second video, the therapist discusses feedback about the client's mood from the previous session, just setting a collaborative tone, actually asking about the mood ratings that they had from last week. So, okay, would you rate your mood on a scale of this to 10, and carrying forward with that? So the third goal, or the third step to agenda setting, is assessment of current mood. So as I was saying that they did in the second video by Qualia Counseling Services, um, just sometimes this may look like a rating on a scale of 1 to 10 to see where a client is feeling in that session. This is really helpful, and I really picked up on this when watching the Qualia counseling services video. It's helpful to do this because then you can get a gauge on, okay, I remember my client was feeling like they were a 4 last session, and now they're feeling this session like a 3. Where are we going wrong here? What are some steps we can improve to maybe get that up to a 5 in the following session of next week? So it's just nice to have that really structured and something we can refer to get a gauge of the client's emotional state. So this can also help tailor the focus of the session and set some extra goals of what we would like to achieve with that client. So just to go into that literature and talk about how it's supporting this. So looking at the text from Kennerly et al., the authors do suggest using very standardized measures or informal questioning to assess mood. As I mentioned, I definitely see the value behind using standardized measures just because there is that point of reference. So we're always going to be able to go back and reassess how are they feeling the first week when we first started our sessions with them? How are they feeling now that we've been working with this client for 1 month? We can see, oh, we've really made some progress, or maybe there's some things that we need to tailor because this, like whatever's going on, doesn't seem to be working for this client. So let's go back to the feedback portion as well and maybe get some honest feedback about why that is. So as you can see, these steps to agenda setting really do go hand in hand and are really useful if we employ them properly as counselors. So looking at the article from Simons and Griffiths that was published in 2018, the authors recommend adjusting the session length based on the client's current emotional state, which I find is really interesting. So let's say they're feeling like really low and having a really low day. Maybe they don't want to do that normal 90-minute session if that's something that is our norm. Maybe they don't feel like going through that, or maybe if they are feeling really low, maybe they need a bit of extra time. So that's why it's nice to have that rapport with the client and keep that open-ended discussion going, just to see how we can help them best based on the current mood, keeping in check with how they're feeling right now during the session. So, by Eubank et al., in their 2020 article, they discussed the need of initial assessments to help guide the content of the session and ensure a focus on the therapeutic method. So, obviously, it's important to do this at the beginning, which is why this is number 3 out of the 7 steps to setting an agenda, because it's kind of pointless to assess a client's mood halfway through a session when we could have structured the whole session around the fact they're feeling great that week. So that's awesome. Let's talk about what we did properly from our homework from previously leading until now to have them feeling great. Or let's maybe talk about what we could do to tailor therapy a little bit because their mood really didn't improve. So definitely important to check in at the beginning of the session for this. So in the 2019 article by Wolk et al., the authors discuss the high intentions to use structural components like agenda setting and mood assessment can suggest that this is seen as integral to the therapy process. So it's really important to the therapy process for a counselor to go in with really heightened intentions to make sure that we assess moods and set agendas just to stay on track and have points of reference. So to refer to the videos, in the second video, so the one by Qualia Counseling Services, the therapist does use a mood ranking scale to assess the client's depression, which allows for a focus on the discussion and presenting issues. So I found that the counselor here did a really great job at assessing the mood. They had quite an in-depth conversation around that and really structured the session based on how that client was feeling at the time. So they did that very well. In the first video by Todd Grande, was a bit more vague. So there definitely wasn't that exact mood ranking scale that I personally would use that approach in my practice because I do see the value of having that very structured, that number to follow off of and continue to refer to. So that would be one criticism to the video by Todd Grande and one plus that I noticed the therapist did in the Qualia Counseling Services video. So the fourth step is going to be a review of homework. So the purpose here is to discuss tasks that were assigned in the previous session and have an appropriate understanding of their impact. So let's go into the literature about that. So in the textbook, Kennerly et al. Found that homework should be relevant and consistently reviewed to reinforce learning, which I absolutely agree with. Um, we shouldn't just be using cut and paste things that we're using for all of our clients. We shouldn't just be giving them the same kind of worksheets from time to time again. We should really tailor it to that client that we're using specifically. Obviously, for the sake of ease, it does make sense to reuse certain things, have templates that we're following, but this is what the client is going to be carrying with them for this entire week. So we have that 60 minutes with them, but the homework is going to determine how they're going to deal with life outside that 60 minutes with us. How are they going to deal with this difficult issue at work that we spent time working on? And when they need that refresher, this is going to help them know how to better deal with situations and handle their emotions. So let's really put effort into this and do something that's going to be tailored to the client. Let's review it to see where we're going right, going back into that feedback and mood ranking, and just let this work synergistically to ensure that the homework we're giving the client is best serving them through the week. So Simons and Griffiths in their 2018 article do discuss the need to do homework thoroughly to understand and have a client adhere to it. And Eubank and the other authors in the 2020 article also find that homework is extremely important to help achieve better clinical outcomes. So it's also linked to patient engagement and improvement. So it's obviously important what we learn in that session, but just knowing how to apply that through the week. And let's say you go into school and you have a really great lecture that takes place for 60 minutes. You're probably going to need to go do your readings after. You're probably going to walk away from that lecture. Not you're going to really enjoy what you heard, but you're going to start to forget things as we go on. Maybe something flusters you, or you have a quiz, and as you're getting asked that on the spot to apply it, you get thrown off a little bit. So that's why having homework and having something to refer to and remember when you're outside of the session is going to be so critical for that client, and obviously findings to support that. So in the Volk et al. Study, so high clinician intent, it was found that clinicians that have high intentions to review homework, it does reflect the critical role that it has in CBT structure. So that obviously does have a very positive impact on the client. One clinician is going in with a really high motivation to get that done for them. So in the first video, I found the therapist did a really great job at reminding the client about homework that was related to their work difficulties and discussing what was completed and what challenges they may have faced. So that was done really effectively in the first video. And they did go back a lot to the challenges that that client was having at work. So the fifth point, the main topics for discussion. So that is the fifth step of agenda setting. The purpose here is to really focus on the key issues that need to be addressed within the session with the client. So this is where we're going to zone in and see how we really set the tone for the remainder of this session with the client. So in the supporting literature here, in the textbook by Kennerly, published in 2017, it's recommended to prioritize issues here that are based on the distress level of the client. Look at relevance and potential for change. So obviously we don't want to just delve into something here where maybe we're not prioritizing the right things. I'll go back to how in the first video by Todd Grande, he did a really great job at this. So see how the client's feeling and then make adjustments based on that. At this point, we've been in practice for a long time, and hopefully, and we should be tailored to our client's current mood. So just being able to adjust on the fly is going to be really important, that we're not just giving cookie cutter approaches. So let's set an agenda based on how they're feeling right now, go into their session with a certain mindset after reviewing their notes, but just be prepared to tailor that. So Simons and Griffiths, in their 2018 article, also discuss the importance of structuring the session to cover all agenda items and remain flexible with time while doing so. And in the 2020 article by Eubank and all, they talk about the negative impact of putting non-therapeutic content within the agenda, and talk about the need to focus on therapeutic change methods just to make sure we can improve outcomes here. And Wolk et al. In their 2019 article discuss that the strong intentions to use in agenda setting also shows that there's importance prioritized by clinicians. So that has some positive results as well. So when clinicians go in with a strong intention to use agenda setting, the clients can perceive that importance and it will have positive change and positive effect on their outcome. So definitely a really important step here. Going back to the videos, in that video by Todd Grande, I just want to talk about how great um, the therapist did at really getting the client to rank everything. They really delved into, okay, what do you think the most important is to you right now? What do you think is causing you the most distress? And she decided that school, you know what, schoolwork, that's having a bigger impact on my life right now. If I don't get a good grade, that's going to mess up my future. So let's focus on that. And in the second video, the therapist did discuss issues from the past week, focusing on low points and identified any main topics for discussion here. So they both did a really great job, I found, at that. But I did really want to highlight video one. So number six is going to be to set more homework and another assignment. So now from this current session, let's set homework on what we want to work on for the next week and put effort into that. So this is going to help stay on topic with what we're working on in the session and give the client something to work on for next session, something to refer to when they're feeling really troubled, giving them some resources outside of that. So they're getting more than just that one-on-one in therapy. So in the textbook by Kennerly et al., the researchers find that homework should come organically from the session's main topics. And sometimes this can take some time, maybe up to 10 minutes to set up, but it should be something that naturally flows from what we've been working on in that session. Simons and Griffith also found that homework tasks should be very clearly planned, just to make sure that there's understanding and relevance. You don't want to give something really vague and then send your client off to go home and think, okay, I didn't really understand that. It seemed like we didn't focus a lot on it and zoom through it, and it really didn't make sense according to what we spoke about. They're probably not going to do that homework, so let's give something that they're going to find that they're going to think is very useful to what they're working on right now. So Eubank et al. In their 2020 article did find, or study found that setting homework and putting this in place in the agenda setting process was associated with increased patient engagement, which really showcases its importance from the first session carrying over. So making sure we're doing this every single time. In the 2019 article by Wolk et al., planning and reviewing homework also did show high clinician intentions and reinforced that this task is very essential in the cognitive behavioral therapy process. So definitely literature supporting this important step. In the first video, I wanted to point out the therapist planned to give a homework related to managing schoolwork and making sure that the client understood the tasks. They reviewed this a lot. I really liked the way in Todd Grande's video that he gave homework and they did spend a lot of time, even though it was just a short video. So we can't speak much on what they did in the rest of the session. They spent a lot of time talking about how they wanted to set up the homework, talking about the importance of her schoolwork, why she wanted to do this, and that I found was very clear and engaging for the client likely. So the final step is going to be feedback. So the purpose here is to gather the client's thoughts through the session, which can help them inform future sessions. So the Kennerly literature supports this by encouraging honest feedback and take home messages to reinforce that learning and just help that stick with the client. In the 2018 article by Simons and Griffith, the client reflections do provide insight into their emotional state and their understanding of that session. So really important to know where they're at. And it also is going to really help build rapport by having that constant back and forth with your client. Eubank et al. Also did found that eliciting feedback had a positive association with better clinical outcomes. So that really does show the importance in the therapeutic process of agenda setting. I found the therapist in video two did a great job of constantly asking for feedback. He really focused in the one by Qualia Counseling Services on going back and forth with the client. I found there was a really great back and forth and rapport there, although it was a practice video, talking about mood, talking about feedback. How did you feel about things from last session? They did the same in video one with a back and forth. I just found there was a really positive, clear, structured focus on knowing exactly how they felt from last session till now. Let's talk about your mood from last session till now. How did you feel through the week? How do you feel about what we're doing? So that was a really, really great job there. So we're running out of time, so I'll try to go through this critical evaluation fairly quickly. So in the first video, just to go through a critical evaluation of the two videos, So, in the first video by Todd Grande, the therapist opened with, "How are you feeling today?" I found that this simple check in really set a positive tone for the session and allowed the client to share immediate concerns. There was definitely a structured setting. They were asked to prioritize topics such as schoolwork, work, relationship, and then rank it based on that. So, this really helped focus on the most presenting issues. And I really like the way that therapists narrowed this down to stay on track, and they eventually zoned in to say, we have all this going on. Schoolwork's most important. Let's focus on that. A critique would just be effective prioritization. So they did a great job at looking at the most distressing issue. And that ensured that it did remain impactful for the client. I did find with things like ranking mood, there was some vagueness, as I mentioned earlier within the presentation. So that's one thing that I would say, like for a critique, that I found video two by Qualia's Counseling Services did slightly better, just with really being very clear on all the steps through agenda setting. Um, Personal preference here, I really did like the structured approach here and the prioritization. I like the way they broke things down and looked at all areas and then zoned in on one. I found it helped maintain the session focus, and they really made sure that all the important issues in the client's life was addressed. And I did feel like the client, there was obviously rapport, and she felt very opening up with everything about the therapist, about what was going on in her personal life, and they had a very good communication style. So delving into the second video by Qualia Counseling Services, in the opening, they looked over the last session, current mood, and the week and how that went. So the review really helped. They really helped build continuity, I found, from each session to the next. So there was a really great kind of flow you could tell where the therapist was doing a great job at discussing how they felt last session through the week based on mood ranking. So it was a very good reference point. And then talking about how they wanted to set the tone for the next session. So I just found there was a lot of accountability. Nothing was really getting lost. So nothing was getting wasted while they worked on that in the process. So the structured setting here, I really like the way that they structured everything to use feedback and the mood assessment to set the agenda. This did make it really specific for the client, and involving the client in the setting, which they did really actively. Like I found there's a lot of active client involvement here. Um, this made sure that they collaborated. A lot of stuff was based on how that client was currently feeling, and they wanted to set the tone based on their mood. So that just makes sure that the session is going to be aimed to meet the client's needs, which at the end of the day is all we're trying to do is to help improve their mood, make them feel better, making sure we're focusing on that individual client. I really like the collaborative approach here and the frequent client involvement. I really like the engagement from the counselor, that they really were in tune with their client and probably provided different feedback for every client. If they had another client walk in, I feel that it would have been a completely different session. You would have brought a completely different energy there. So I did like that collaborative. So personal preference, that I would like to apply in my own practice. I really did like the collaborative nature and use of behavioral activation, which is an effective technique in addressing mood issues. And the client involvement made sure that we were doing client-centered therapy here. So some common difficulties and strategies. All right, running out a bit of time here, so I will just be speeding up my tone. The first difficulty would be time management. So I can see this being a huge issue if you run out of time for major topics. So this could obviously lead to incomplete sessions, unresolved issues, which would affect the therapy's overall effectiveness. So a good strategy for this would be to allocate specific time slots for each agenda item. And structuring the time here can really help make sure that all important topics are covered and that the session remains effective. So like they did in the video by Todd Grande, just making sure, okay, we know schoolwork is the most important here. Let's focus on that. Maybe if we have some extra time, we'll talk about your relationship and your work, but we're delving right into school. Another issue would be client overwhelm. So let's say a client brings up way too many issues. This can really scatter focus. So it's our job to rein them in here. The strategy here would be to gently provide prioritization, give a kind approach to making sure that we're staying focused on the key issues. So this is also going to help clients prioritize things and ensure that the most significant issues are addressed, helping impact the session. And then they won't get overwhelmed by, okay, it's my session now. I want to tell you everything that happened this week, which I can see is a really easy thing to fall into. We want to help them as much as possible, but to get the most out of the time we have, we do really have to zone in rather than going kind of all in a bunch of different areas. So the third difficulty would be a lack of client input. So let's say the client really isn't contributing to the agenda. This could be a huge issue. Maybe they have a low mood, maybe they're not feeling it. They're just a bit overwhelmed and aren't feeling open to share. So this could have a lack of ownership and engagement in the therapeutic process where we're really having to lead it by ourselves. So building rapport here, encouraging active participation, and just really validating their choices is going to make sure that they're more engaged, feeling open to share, and that the therapy we're doing here is client centered. So, just to back this up with some insights from other articles. So, 2020 in a 2020 article by Johnson and others, they really emphasize having collaborative agenda setting. So, by taking part in collaborative agenda setting, this helps build trust and ensure that the sessions are going to be tailored to the client's needs, and this will enhance the engagement and effectiveness. So, Wolk et al., in their 2019 article, they show variability in clinician intentions. So, the variability in these intentions does highlight the need to have personalized strategies and agenda setting to make sure that we're meeting different client needs. So, staying well versed depending on the client. Waltman et al. In their 2016 article did find some common pitfalls, or found that like there were a lot of common pitfalls in agenda setting. But understanding these can really help develop strategies to avoid them, improve session structure and outcomes. So just keeping track of what these common issues are, like in the list we just made, keeping them in the back of your mind and saying, okay, if this comes up, how am I going to avoid it to make sure the client is getting the most out of this? So just to conclude this video, effective agenda setting is really crucial in cognitive behavioral therapy. It involves a structured approach, prioritizing client issues, and encourages client participation. So for a call to action, we can implement these strategies in our practice to just ensure that we're enhancing the session effectiveness and improving client outcomes. Thank you so much for listening to this presentation. I hope you have a great rest of your day and enjoy practicing agenda setting and cognitive behavioral therapy.